Hi there, John the Osteopath. Just want to wish you all a happy Christmas. As you can see, I'm in my festive jumper. I've got a couple of videos I'm doing at the moment. I want to start off with a client of mine who's had a rather nasty injury. So he's broken his tibia and damaged the cartilage in the tibia. So what I like to do with someone who's just starting physio, about 6 weeks in, is to try and put a bit of traction through the knee joint. And you may have seen this exercise before, but I'll show it to you again. You want to find yourself a table. So this treatment table I've got is perfect for this. You want to sit down on the edge like so. We want to basically move the synovial fluid, that's the fluid in the knee joint, and move it around the joint, because the synovial fluid provides the nutrition to the joint surfaces. So the way we do this first, we're just sitting like so, and try and do some gentle circles like that. Try to do a pendulous motion. In other words, you're not using your muscles too much. You're using the momentum of the leg as it goes round. Now this is best done with a heavy pair of boots, because you can use the weighted boots to pull the leg downwards, increase the space between the tibia here and the femur, okay? And work in both directions, both clockwise and anti-clockwise. So that just provides nutrition to the joint, and there's no compression on the joint, so it really is rather good. And you may get a bit of discomfort in the kneecap, because the kneecap of course is being pulled down as this occurs. Don't be upset by that too much. Simply let your leg straighten and come back. So we do some leg extensions as well, nice and slowly. So unlike the first movement, which is gentle pendulous motion in circles, clockwise and anti-clockwise, which you do for about 2 minutes, you then want to finish off by doing some leg extensions, very slowly, pausing at the top and coming down. Now, I don't always like my clients to go right to the point where the leg is super straight, because as you do so, that actually jams the kneecap a little bit tighter. So I like to let the leg come down a little bit further to there. So if you look at it from me from the side, over here, the leg will come almost to straight, but not quite. Straight would be here, just that position there, and lower. And they always pause at the top to get a contraction through the muscles in here. And you're really aiming for as many of these as you possibly can do. Of course, if you've got a heavy pair of boots on, that's a bit of resistance too. This mimics the leg extension machine you do in the gym. And that will be the next stage on from this particular position. And now finally, of course, we need to think about the hamstring. And really simple stuff. You can just come and stand up, balance on one leg, hold your tummy in tightly, squeeze your buttocks, let the knee bend so the foot is behind you, and simply curl the leg up and curl the leg down, up and down. Now don't let the foot rest on the floor here as I'm doing, making sure it's just off the ground. So you maintain continuous tension in your hamstrings, like so. You may find you want to lean forward, so lean to the hips, and then you've got a slightly greater range of motion as you do so, like that. But watch your back with this exercise. You may be better off just in an upright position, just curling up and down. So although the range of motion isn't particularly big, you are still activating that muscle. You may find if you have a knee injury as well, your range of motion will be limited as well. So this is a good exercise. So let's recap that again. So start yourself off with 2 minutes of gentle rotation, one way and the other with a weighted shoe, ideally. So you have a nice gentle pendulous motion, simply to massage the joint surfaces. Following on from leg extensions, like so, not to full straightening, just part of the way, okay? Maintaining the tension on this quadricep as you go. And I'm not going to give you a fixed number, like I said before. You may find you can crank out 100 quite easily. You might find 10 is easier. But don't go to failure. Always stop at before you get to failure, because you want to do this quite a lot. If you train to failure, you're going to actually break the muscles down and you're going to irritate the surfaces too much. And then finally, of course, the leg curls. Straight, squeeze your buttocks, tummy in, knee behind you, curl up and curl down, curl up, curl down. Don't let your foot touch the floor. There we go. And lean forward a bit more if you want to, so you've got a greater range of motion, like that. As you can see, my knees going back behind me as I do this. So activating the top of the hamstring as well as the bottom. And again, with this, do as many as you can comfortably. You know, if your back starts to ache, then do stop. So there we go. There's your 3 main exercises to begin rehabilitation of the knee. After that, you'll start to go on to weighting it a little bit. So you might want to use ankle weights, or you can use a band. But let's just start at the beginning, certainly for the first week to 10 days of these 3 exercises. See how you get on, and look forward to seeing the next video. Take care.